Hypertension, also known as high blood pressure, is said to be a silent killer, and more than half of the adult Kenyan population have never had their blood pressure tested. And half of those that have been diagnosed with the condition, they also do not have their blood pressure in check. According to the Kenya Stepwise Survey for non-communicable diseases, 1 in 4 Kenyans is living with hypertension. Data published in 2018 by the World Health Organization shows that in Kenya, 1,818 or 0.71% of total deaths is caused by hypertension. So how does hypertension come about? What's a normal blood pressure? And how do you keep your numbers in check? Well, to help us in answer this is Dr. Lilian Bao, the CEO, Kenya Cardiac Society. Thank you very much, Daktari, for joining us.
Thank you.
So what do you do at the Kenya Cardiac Society?
So at Kenya Cardiac Society, we are basically a professional association that brings together health providers who focus in the field of cardiovascular diseases. And cardiovascular diseases, we are talking about diseases of the heart and the blood vessels. And that is where hypertension falls in. So basically our focus is on cardiovascular diseases. We focus a lot of our work training our health workers so that they are able to manage these conditions. And we also do a lot of awareness creation. And as the topic of today, hypertension, we have done a lot of work trying to ensure that Kenyans understand what is hypertension, how do they get hypertension, how can they manage hypertension. So we do a lot of campaigns, we do a lot of screening activities so that we can ensure that people are aware of this condition.
So it's all about creating awareness of... Now we've had many a times Kenyans saying pressure yangu iko juu and all that. What exactly is hypertension?
So hypertension, or what we say simply high blood pressure, is the pressure that is in your blood vessels. So we all have blood vessels in our body, and we have blood that flows inside the blood vessels. So sometimes the pressure with which the blood is flowing in the blood vessel can rise. So that is what we call high blood pressure. So I'll give an example of a tap. So if you have a tap and you've connected a pipe and you're maybe watering a garden, there is that pressure which the water is flowing into the pipe. So if you open the tap wider, the water will flow with higher pressure. If you close the tap or reduce the flow of water, the pressure reduces. And also you can use the example of if the pipe is thinner, the pressure will be higher. If the pipe is wider, of course the pressure will be lower. So that's basically what we're talking about. What is the pressure with which the blood is flowing inside your blood vessels? Yes.
Okay. Now maybe we can just talk of a normal blood pressure, even as we discuss the types of hypertensions that you have.
So when you go to a health facility, for example, and you get your blood pressure checked, usually this is the kind of device that is used. It is placed on your arm, and the health provider will give you 2 numbers. They'll give you a number that is on top and another one below. Basically what you need to know, there will be 2 numbers. And the number that is, the first number which we put on top refers to the pressure when your heart is contracting. So your heart is a pump. And it contracts and it relaxes. When it contracts, of course, then it pushes blood into your blood vessels. The pressure is higher in the blood vessels. When the heart relaxes, the pressure in the blood vessels will go lower. So you'll be given 2 numbers. And for example, if I can say what is exactly normal, so normal, or what we call optimal, what is the best blood pressure to have, is when the top number is 120 and below, and the bottom number is 80 and below. So if you go to a hospital and, for example, you're checked and you're told your blood pressure is 1, don't say it's not really the ideal, but they are not sick. It is still a normal blood pressure. The problem comes about when the number on top is 140 and above, and the one below is 90 and above. So if you visit a hospital and your health provider tells you that your blood pressure is 140 over 90, for example, then that is already on the higher side. So you'll be told that you have high blood pressure. But for us to really confirm that you're hypertensive, we usually need to check it over several days, because sometimes we don't rely on one blood pressure, because things like anxiety, things like stress can temporarily make your blood pressure go up. So we like confirming it over a few days, and if the blood pressure remains above 140/90 and above for several days, then you will be considered a hypertensive or having hypertension. Yes, so just to recap, if your blood pressure is 120/80 and below, that is ideal, what we call the perfect place you want to be. If it is between 120 and 140, the top number, 120 and 139, the top number, and the bottom is 80 to 89, you are still normal, but you need to be careful, especially if your blood pressure is heading towards 130s, towards almost nearing 90. If you're almost reaching 140/90, we usually say that you need to be very careful. You need to start making some changes, which I will talk about, so that you don't progress into the range of being hypertensive.
Now, just to take you back, you've talked of these two numbers, the one on top and the one below, and you've also talked over the heart contracting and all that. There are these two terms. Is it diastole and systole?
Yes,
yeah,
I was
maybe.
trying to avoid because
Okay,
making it complicated,
yeah.
but the top number is systolic and the bottom is diastolic. Yes, so if you want to be more scientific, the top number is the systolic blood pressure and the bottom is the diastolic blood pressure.
So as we've seen, more than half of the Kenyan population have never had their blood pressure tested. And measuring the blood pressure is a very simple process, and we are going to demonstrate with the help of Daktari.
I'm going to have you sit down, facing the side. Yes. So usually we like the hand rested on the table, and usually we want the person to have rested for about 5 minutes. So if you had just walked in, I would have requested you to rest for about 3 to 5 minutes, but now because you are seated, so insert this device here.
Area, and we meet one Constant Nyongesa who was diagnosed with hypertension at the age of 23, and he has been living with this condition for more than 10 years.
I was first diagnosed on this hypertension back in 2010 when I was around 23 years old. So I just went to a hospital for just a normal checkup or for a normal treatment. But when the doctor did some tests on hypertension, in fact my BP was very high. It was around 160 to around 100, over 100. So he was like, "Hey young man, what is wrong with you?" So I was like, I don't know anything about hypertension, blah blah blah. So he said, sit and we want to redo it again. So when he did the second round, it was now around 145 to 98, around there. So I was told to go back home, and then I had to go back again after 2 days to see what has, if the PB has gone down. So when I went, it was still at 145, so I was put under medication. In most cases, he talked about eating junky foods. That's what I used to do, and also taking raw salt. In most foods, like I could eat, before even I taste it, I have to add some salt on it. So those are some of the main causes that led to my BP to be very high. Okay, after I was diagnosed on the hypertension under medication, so I went for several counselings, guiding and counseling sessions or support groups. So I was taught how to live with this disease on a lifestyle situation. One, I was told not to take any solid fats when I cook, so I had to change it to liquid, like cooking oil in most cases. Then I was advised to take traditional vegetables, and that's what I have been doing. And also I was advised to do exercise, and in most cases I'll find myself doing a small exercise, at least to ensure that I am physically fit, and also I don't increase my cholesterol in the blood. So I was advised to do that, and I'm following it.
Now, when it comes to hypertension, are there symptoms? Are there things that maybe you can check for you to say that I underwent these symptoms?
Yes, this is a very important point that I want to bring out. Hypertension is a silent killer. Why do they say that? Because when hypertension begins or is in the early stages, we do not have symptoms. So you can actually have a blood pressure of 150/90, which is high, but you don't have symptoms. So usually what happens in the initial stages, when your blood pressure starts going up, you will not have any symptoms. And that is really concerning, because a lot of Kenyans, if they don't visit a facility for whatever reason, will remain with that high blood pressure. Yeah. And the risk is that if you continue staying with that high blood pressure, you now get complications, which I'll talk about. Things like a stroke. I think many people have heard of strokes, where somebody gets paralyzed. That is one of the complications. So you can find somebody who was perfectly normal, going about their business, and then one day they get a stroke. And people wonder what happened. But that person actually had a high blood pressure without symptoms, and then suddenly the pressure went very high, and with time, of course, the pressure affects your blood vessels, and then one day you just present with a stroke. And that's why it is very important. The message we want to preach is majority of people who will have high blood pressure in the initial stages will have no symptoms. Now, if you stay with that pressure for quite some time, you've had no symptoms, now you know the pressure starts affecting your organs, because basically it's a blood that is flowing to supply nutrients to your organs. That excess pressure affects your organs. It affects your kidneys, it affects your heart, because they are not designed to cope with those kind of pressure. So over time, they start damaging those organs. Now you start getting complications. For example, you can start having your heart beating. People complain a lot of feeling their heart is beating very fast, what we call palpitations. Some will complain of headaches because the pressure is affecting the blood vessels in the head, so they complain of headaches. They complain of dizziness. For men, because this blood flows in all the organs, including the sexual organs, so you find a man who is not able to perform in bed. That could actually be, a complication of hypertension. Your vision, so the blood vessels supplying your eyes get affected, and you're not able to see well. Those are the kind of symptoms that you will have. But by that time, it means you've probably stayed with it for a long time, and you're starting to get complications. So the message is, for majority, they will not have symptoms, but for those who have stayed with it for a while, those are the kind of things they'll start complaining about. Commonly headache and palpitation, the heart, feeling that the heart is beating, feeling tired, feeling dizzy. Those are common symptoms when people are starting to get complications.
So it affects other body organs?
Yes, that is actually what we fear more, so what we want to avoid. Because that pressure with time affects your organs, and you start getting complications. Yes.
Now that there are no symptoms that you can pinpoint, what causes hypertension?
So let me start by saying that we have two types of hypertension. We have what we call secondary hypertension and what we call primary hypertension. Secondary hypertension is rare. It affects about 5% of the population. And secondary hypertension is related to a problem either in one of your organs, or it could also be related to something that you're taking in. For example, if a lady is taking oral contraception, some of them can get high blood pressure. If you have a problem with your kidney or any other organ, you can actually develop high blood pressure. So secondary hypertension only affects 5%, and usually it has something that causes it. It has a specific cause. But we will not focus more on that. We want to focus more on primary hypertension, which affects more than 95% of the population. And the reason we want to focus on primary hypertension is because it's heavily linked to our lifestyle. Now, if you look at primary hypertension and the risk factors, what causes primary hypertension, we say we have what we call risk factors. These risk factors, they are those we can change or we can modify. Things like our lifestyle. So here is where we have things like our diet. If our diet, we are not taking enough fruits and vegetables, if we are taking a lot of salt, if you are taking a high carbohydrate diet and we add weight. So these changes can actually result in high blood pressure. Again, on the things we can modify, we are looking at physical activity. If we are more sedentary, we are not doing a lot of physical activity, we are not walking, we are taking the lifts, we are taking vehicles, we are more sedentary. Basically, it can contribute. And also, if you take if you take alcohol and you smoke, this also contributes to high blood pressure. But also, we have now the risk factors we cannot change, but which predispose us to getting hypertension. Things like age. It has been shown that the older you get, you're more likely also to develop hypertension. Other factors which you can't change is the race. So black people have been shown to have higher risk of getting hypertension. Also age. So below 55 years, we usually find that men are more likely to have high blood pressure than women. So these are things like age, things like sex, things like race, we cannot change. But other risk factors I've talked about, the ones related to our behavior, that's where we need to focus more because we can actually change. So all these things contribute to people developing hypertension.
And where does stress fall?
Oh yes, stress also contributes. Stress is modifiable, of course. So you find that if you're under stress or if you're in conditions that cause you to have stress, over time this can also contribute to you developing hypertension. So we usually say these factors sometimes don't happen on their own. Tends a lot of times to be a combination of factors. So you find you're aging, you're adding weight, maybe you take alcohol, then you get hypertension. So these factors are not necessarily working alone. Many times you find they all come together and contribute to you getting hypertension. Yes.
Okay, now to the prevention. Now that you've just mentioned it's a lifestyle, we can say maybe it's a lifestyle disease.
Yes.
How do you prevent?
So because I've said 95% of people, it's related to their lifestyle. How to prevent is to address the factors I've talked about. So for example, the diet. So the factors that contribute to hypertension is, number one, not eating enough fruits and vegetables. So we are recommending that you take at least 5 servings of fruits and vegetables in a day, 5 servings. And if you look at the statistics, that there was a survey done, the STEP survey, which was done by the Ministry of Health. They found that more than 90% of Kenyans do not take adequate fruits and vegetables. And there are many reasons. Sometimes we want to say that they're actually more expensive than some other things like carbohydrates. If you compare the cost of carbohydrates and fruits and vegetables, a lot of times you'll find it's cheaper to buy a chapati, one chapati, you buy one mandazi, than go and buy a mango or a banana or an orange. So there are a lot of reasons why people are not taking enough. Of course, some are not aware they should. But what is 5 servings? So 5 servings, for example, if you look at a fruit, like a normal sized apple is 1 serving, average sized orange is 1 serving, a bowl of traditional vegetables is 1 serving. So in one day, you should at least have taken 5 servings. So maybe an apple in the morning, maybe a banana at 10 o'clock, maybe you take a bowl of vegetables at lunchtime, at 4 o'clock you take another fruit, and at supper time you take another bowl of vegetables. So you make sure you take at least 5. But of course, it could be expensive for most Kenyans to afford, but that's what we are recommending. So the other thing is salt. So salt is the other thing that has been shown to contribute to high blood pressure. So when we take too much salt, what happens is salt attracts water, so we retain more water into our system, and of course that adds to the pressure in our blood vessels. So we encourage, especially those who've been found to have hypertension, we encourage them to reduce the salt in the food. And what are we recommending? We are recommending that everyone should take at least 1 teaspoon of salt per day. So if you look at everything you eat from morning to evening, you should not go beyond 1 teaspoon of salt. Sometimes it's a bit hard to measure because, of course, we are cooking food as a family, you know, but you need to be very careful, especially about snacks. So snacks like groundnuts, maybe crisps, which you eat as snacks, they tend to have a lot of salt. Even bread itself has salt. So what we recommend is for cooked food, do not add more salt in cooked food. If you have cooked food as a family, do not put the salt shaker on the table. Avoid that completely so that people don't add salt. Avoid processed food, like packed, these packed cheddars and groundnuts, they tend to have a lot of salt. So try and avoid a lot of those packed foods because they tend to have a lot of salt. Yeah, so then for diet, we also recommend reduced fat. And fat, we're talking a lot about foods which have processed, saturated fat, which is in processed food. Again, I'm back to processed food. If you can avoid anything processed, we are trying to recommend that you eat your food as natural as it is. Avoid a lot of processed food, like packed. You go to the supermarket and buy a packet of queen cakes. All those processed things tend to have a lot of sugar and fat, which are not good, and they cause weight gain, and eventually you get hypertension. Now, the second thing is physical activity. So we finish with diet. Physical activity, we need to be active. I think our lifestyle has become very sedentary. We want to take borders, distance where we would walk before. Now borders are available. You go to a building, you take a lift. So we are saying that you need to do at least 30 minutes of moderate exercise in a day. If possible, every day. If not, at least 5 days a week. And what is moderate exercise? Moderate exercise, things like walking, but not walking leisurely. Try and walk a bit briskly. You should be able to sweat. You should be able to be a bit breathless for it to be exercise. So if you're walking leisurely with your friend, that may not contribute. So walk at least a bit briskly so that you sweat a bit, you become a bit breathless, you feel your heart, racing. So that is considered exercise. So you can do skipping, you can dance, you can do farming. There are a lot of things you can improvise. You can run, you can cycle. So try and make sure at least every day you're putting in 30 minutes of moderate exercise and avoid too much sitting. There's some careers that involve a lot of sitting. So we recommend after 1 hour, get up, walk around, go to the washroom, get some water, sit. So every hour, try and become active and sit so that you're not sitting in the office the whole day. The other thing is alcohol. I won't say much about that. We are obviously trying to get people to reduce and stop, preferably stop. But you can start progressively by reducing the amount you're taking. But the goal is to avoid alcohol completely, because in Kenya they're saying one in 5 Kenyans takes alcohol. So it means that a fifth of Kenyans are taking alcohol. So I think that is going to be contributing to more people getting hypertension. So we need to stop taking alcohol, and of course smoking. We need to avoid smoking. Those are the kind of behavioral changes that we want to adopt. The other thing I want to talk about is stress. I know this, like now with COVID and all these, there are a lot of factors that may be causing you to have stress. So if you have issues that are stressing you and you're always anxious, you can get somebody to talk to, get professional help. But try and do some exercise. Exercise also reduces stress. So get something to make sure that you're not getting stressed, because stress also raises your blood pressure. So manage your stress accordingly. Yes.
Okay, so you just talked of a number of body organs being affected. What are some of the complications that hypertension can bring?
Okay. So the reason that hypertension affects the organs is because the blood flows into all the organs and supplies nutrients. So when the pressure is high, it will affect most of the organs in the body. But the common ones where we get complications is the brain, and that's where you get a stroke. So you have the vessels in the brain getting blocked, and eventually you find somebody getting paralyzed because the brain controls the movement of the body. So when the blood pressure in the brain is too high, the blood vessels have been affected, they block, you get someone getting a stroke. Now, if you come down to the heart, you find people, the heart, when their blood pressure is too high, the heart works overtime. And when the heart works overtime, over a certain period, you get what we call heart failure. Basically, the heart gets fatigued, and the muscles get affected, the muscles of the heart, and it's not able to do its function. So you find people getting heart failure. And when they get heart failure, they need to get medications. The other thing you can get is what we call a heart attack. A heart attack is basically when the blood vessels of your heart are blocked, because with time the hypertension, high cholesterol, they result in your arteries getting blocked. And if the arteries of the heart get blocked, you get what we call a heart attack. And you find somebody coming in with chest pain, and sometimes if the vessels, a lot of vessels or big vessels are affected, the heart fails completely, and someone can even present with a very severe heart attack and they die immediately. So that's another complication. We go down to the kidneys. The blood pressure is very high, the kidney is affected, and you find people getting kidney disease and kidney failure, some eventually requiring dialysis or kidney transplant. So that's another complication. The other part is the eyes. Blood pressure in the vessels supplying the eyes over time, you start getting problems with your vision. Sexual organs, so your sexual organs are also not spared because they require a blood supply. So you find people presenting with erectile dysfunction, which is basically not able to perform sexually, and this can affect both men and women, but of course commonly it affects the men. So those are sort of the common complications that you find people presenting with. Yeah.
So we've just talked over what to avoid and what to do and what not to do. Now that someone has been diagnosed with hypertension, how do they manage? Is there a treatment?
Yes. So there are two types of treatments. Number one is lifestyle, and I will continue emphasizing lifestyle. You need to change your lifestyle. And secondly is medication. So what happens, if you come to the doctor and they inform you that you have hypertension, they'll be able to categorize the hypertension. So there are those who will have mild hypertension, meaning it is above 140/90 but not too high. Those who have mild hypertension, the doctor may suggest that they do lifestyle changes and not start medication immediately. They'll give you a chance to change your lifestyle for about 3 months and then monitor and see. For some patients, they'll be able to control their blood pressure over 3 months with the lifestyle changes, and their blood pressure comes below 140/90 without medication. The doctor will advise you to continue with the lifestyle changes. But in the event your blood pressure is high, is in the higher range of, I can say perhaps 160, 100 and above, those are people who will most likely start medication immediately, even as they do lifestyle. So we'll advise you to change your lifestyle, but you will definitely need medication immediately. Mm-hmm. Also, if you have complications, you will need to start medication immediately. Doesn't matter whether the BP is, the hypertension is the severe type or the mild. If you have complication, you'll definitely be started on medication immediately. Mm-hmm. So only those who have mild hypertension, don't have any signs of complications, don't have any risk factors, they're able to just do lifestyle. Mm-hmm. And it's only the doctor who will advise you. I know there are people who are told they have hypertension, then they just start managing themselves at home. You need to still go to a doctor. Even if your blood pressure is mildly elevated, you still need to see a doctor so that they can monitor your blood pressure. So that is the kind of, that's how we manage hypertension.
Okay, so Doc, we've talked over a normal blood pressure. We've talked of how hypertension comes about. As a specialist, what's your advice to anyone that is living with hypertension?
So for the people living with hypertension, one of the biggest advice, or the main advice I would give them is hypertension is a lifelong condition. Basically, once you're diagnosed to have it, we say you have it for life. So you need to keep your appointments with your doctor. You need to continue taking medication if the medication was given. If you are you're told to change your lifestyle, you need to work on and change your lifestyle. So it's a lifelong condition. One of the major problems we face, you find patients have been told they have hypertension. They start on medication. They feel better because, of course, the medication will reduce the symptoms. And then they decide, I'm better, so now I don't need any medication. And some of these patients stay at home and then come with complications. You find someone has had stopped their medication, and then after a few months they come with a stroke. So that's a very common problem. So we are telling patients, even if you feel better, the reason you're feeling better is because you're on medication. So you need to continue with those medications. The only person who should tell you you need to stop your drugs is a health provider. So ensure you take your medication, keep your appointments as you've been advised. Even if you feel better, continue taking your medication and make sure you keep in touch with your health provider. And then also the lifestyle, they need to change their lifestyle. If you are taking alcohol, you need to stop. If you are smoking, also you need to stop. The diet, I think you've talked about, eat at least 5 servings of fruits and vegetables. Reduce your salt intake completely. Be physically active. So those are the kind of things we want patients to do. But more importantly is make sure they understand that their condition is lifelong and they have to stay on treatment, whether it's lifestyle or medication for life.
Now, during this COVID-19 period, the people living with hypertension have been said to be most vulnerable. So how do they adjust? Will the management, will it be just the way it used to be, or what are some of the things that they are supposed to adjust during this time, and how do they keep their numbers in check?
Yes. From COVID is still a new thing, and we are trying to understand it. But what we have seen and what studies are showing is that when you look at the patients who have been admitted and those who have severe illness, we're finding that a lot of them have things like hypertension, a lot of them have conditions like diabetes, they have kidney disease, a lot of them tend to be older. So yes, we are seeing that there's that tendency of people with heart disease, hypertension, diabetes getting severe disease. So what we advise patients is, firstly, they need to continue with their treatment. There is currently no change, or there is no recommendation for them to change the treatment they are on. So they just need to make sure they continue taking their medication. We are advising them to keep at least 1 month dose of medication. It's always good to have a good supply of medication, especially now during COVID. So they need to ensure they have at least 1 month dose of medication. They need to keep in touch with their doctor, because what happened when COVID started, everybody got scared. Everybody thought if they went to hospital, they are going to get infection. Which was a valid concern, but we know that the hospitals have put in place mechanisms to ensure that their patients are safe. So these patients, we are saying, continue going to the hospital as you had been scheduled by your doctor, continue taking your medication as you had been advised by your doctor. So none of those should change, but we are also recommending that they need to take the precautions to prevent COVID very seriously, because we are saying patients who are getting severe disease, a lot of them we are seeing have hypertension. Therefore, it means they need to be very careful. They need to adhere to issues like social distancing, so they shouldn't go out and interact with people if they don't have to. If you're elderly and you have a heart condition and hypertension, if you can get somebody to go to the market for you, even better. So try and avoid public areas as much as possible. If you have to go, make sure you have a mask, make sure you keep the social distance, make sure you wash your hands regularly, make sure you sanitize. So basically they need to take these measures extremely seriously, because as I've said, that there is a likelihood that they could get severe disease if they get COVID. So that's the advice we are giving them. And then thirdly, even as we advise them to stay at home, in case they get symptoms which are not normal. For example, if you start getting breathlessness, if you start getting dizziness, if you get swelling, if you get chest pain, any symptom that is not usual, please make sure you go to the hospital immediately. Do not sit at home with those symptoms. Make sure you go to the hospital, because you could be getting a complication, and it's important that you get checked.
So Doc, what's your parting shot to our viewers?
So hypertension is a silent killer. Make sure every year you visit the health facility and get your blood pressure checked. The second thing I want to emphasize is lifestyle. I said more than 90% of people with hypertension, this is because of our lifestyle. We are changing our lifestyle. We are becoming more sedentary. We are consuming unhealthy diets, a lot of fast foods which are rich in fat, rich in salt. We are not taking adequate fruits and vegetables. So these are things that we want to encourage people to change. Eat more fruits and vegetables, reduce the salt in your food, avoid a lot of processed food so that you can make sure you don't get hypertension.
So as we've heard from Daktari, let's make sure that we check our blood pressure yearly, and also in case our lifestyle is not in check, let's ensure that we change our lifestyle for us not to be hypertensive. And also for those that are living with the condition, we've also heard how you can manage your condition for us to live a healthy life. As always, you can always share your comments and queries on our social media pages as displayed down below on the screen. That's all we had for you from Health Nuggets. My name is Aida Munzati, and as always, your health matters.